Hello, I'm Dr. Eric Goulder. I'm a board-certified cardiologist, and I practice at the Heart Attack and Stroke Prevention Center of Central Ohio. Today, I'd like to spend a little time with you talking about what exactly is the BaleDoneen method. The BaleDoneen method is a preventive approach to arterial disease developed by Drs. Bradley Bale and Amy Doneen. They've been practicing this method for the past 17 or 18 years with excellent results with their patients. The central concept of the BaleDoneen method is that it is our inflammation that's driving the whole arterial disease process. So the whole idea behind the BaleDoneen method is looking for inflammation as opposed to the standard of care or traditional medicine, which is going to treat your high blood pressure. If you have high blood pressure, treat your diabetes. If you have diabetes, treat your high cholesterol, without looking for underlying root causes for what's driving the whole arterial sclerotic process. The first step in the BaleDoneen method is that of education. So we just sit down with our patients for quite a while and explain to them what causes atherosclerosis, how the inflammation is playing a role in development of the atherosclerotic plaque, that blockage that builds up in the lining of the arterial wall. The second step is to actually go hunting for arterial disease. The standard of care medicine approach is to look for disease by doing a stress test on you, but that's really not enough. A stress test is only going to show us if you've got a blockage bad enough to be causing trouble. That blockage has got to be 70% or more. Under a BaleDoneen approach, we are actually looking for asymptomatic subclinical disease. And the reason to go look for that disease is to actually make the diagnosis. Do you have arterial disease or don't you have arterial disease? Under a BaleDoneen approach, unlike our legal system, we assume that you are guilty of having arterial disease until we can actually prove that you don't. The easiest way to start looking for this disease process is in the carotid arteries in your neck. It's done with a ultrasound test. It takes 20 minutes to do. It's painless. It's not the ultrasound test you get done if you go to the hospital with a spell like a mini stroke or a passing out spell. They'll do a carotid Doppler on you there. And that's a test that looks at flow through the artery. We actually want to look at the structure of the arterial wall. We want to know if it's thicker than it should be, which means there's inflammation going on in there. We want to know if there's plaque there. That means you've got arterial disease. So if we don't find anything in the carotids, like I just said, we assume you're guilty until proven innocent, we go look elsewhere. We'll do a coronary artery calcium score on you, looking for disease in the coronary arteries. We will do a ultrasound of your aorta, looking for disease there. We'll do an ultrasound of the femoral arteries in your thighs, looking to see if there's disease there. We cannot say you don't have disease until we have really looked everywhere. And it really doesn't matter where we find that disease, because once we find that disease, it puts you at a significantly increased risk of having heart attacks and strokes. Even if we find a blockage in the carotid artery, you have increased risk of heart attacks. If we find blockages in the abdominal aorta, you've got an increased risk of having heart attacks or strokes. So we only use that to make the diagnosis of whether you've got arterial disease or not. Once we find that disease, then we need to know if there's inflammation going on. There obviously was inflammation to get some blockage going on, but in the arterial wall. But if there's just thickening, we want to know if there's an active inflammation process going on. We've got 6 very good tests that we do, blood and urine tests that we do. We've got 6 very reliable blood and urine tests that we do, looking to see if there's actually inflammation going on. And this goes beyond the standard HSCRP that most doctors would do. Once we find out if there's inflammation going on, we need to know what processes are driving that inflammation. And there's a whole host of entities that can do that, including things like obstructive sleep apnea, periodontal disease, endodontic disease, root canal disease, high blood pressure, obviously, high cholesterol. Psychosocial stress can play a significant role. Genetic problems can play a big role in the development of the atherosclerotic process as well. We then treat all those entities optimally to get every single one of them tightly under control, going beyond the standard of care medicine if we have to, and we get the whole inflammatory process to settle down. Once it settles down, the arterial wall, then heals, and it heals by hardening, calcifying, fibrosing, and then that plaque, instead of being a soft, vulnerable plaque that's liable to rupture, becomes a hard, calcified, stable plaque that's not going to cause trouble. We can all live with arterial disease as long as it's stable and not inflamed. What we cannot live with is soft, inflamed plaque that's liable to rupture and cause that heart attack or stroke. So if you have a bad family history, or you've had a heart attack or stroke already, or if you have significant risk factors for the development of coronary disease, and you would like to look into this further, please don't hesitate to contact us at the Heart Attack and Stroke Prevention Center of Central Ohio. We would be happy to talk with you or see you as a patient to help prevent you from having any further problems.